We'll get started here today. My name's Anthony Nappi. I'm the nurse liaison for the Virginia Impact Project. We're happy to arrive at our 12th and final session of our virtual learning series for infection control preparedness across the Commonwealth of Virginia, funded by the Virginia Department of Health. And without further ado, I will introduce our medical director, Dr. Laurie Archibald-Pannoni, and we'll get started. Thank you for coming.
Thank you, Anthony, and thank you all for joining us today. We are excited to be welcomed today by Ava Lena Waldman. Ava Lena Waldman is the program manager of PositiveLinks at the University of Virginia School of Medicine. Ava Lena is a public health professional with over 25 years of experience in health education, risk reduction, program development and management, implementation management, clinical research coordination, and digital health platforms. Before coming to UVA in 2014, she managed HIV/AIDS education, prevention, and treatment programs across organizations on both coasts of the U.S. She's highly experienced in managing resources and operations, ensuring compliance, monitoring, reporting, and developing new policies and procedures. And her passion lies in developing evidence-based, person-centered interventions for people with HIV. Currently, she manages a portfolio of mHealth platforms at UVA, where she works closely with a dedicated multidisciplinary team to provide high levels of support to organizations implementing PositiveLinks, which we'll be talking about today, an mHealth platform that supports engagement in care among people with HIV. She's responsible for ensuring the success of the program and projects at diverse organizations and types across the country and in international settings. We are super excited to have her join us today to share with us her work on a tool of technology that has been so instrumental in really improving outcomes for working with people with HIV. And so with that, I will pass it over. Thanks so much for joining us.
Great. Thank you so much for the introduction. And thank you to everybody. I'm delighted to be presenting here on behalf of our whole team, current and past contributors, and to be speaking with you all at the June Virginia Impact Series. And with that, I'll go ahead and get started. As I understand, people can put their questions into the chat, and I will get to them as they're brought to my attention. So with that, let's see. So these are my disclosures. And so today what I'm going to do is provide an overview of the PL platform, describe some of the key features of the member or patient-facing app, and highlight some key research outcomes that we learned and has provided the evidence base for this platform, as well as share an overview of different implementation models, as well as the onboarding process that we support. And to sort of wrap things up, I will introduce some of the adaptations of the PL platform that are we've worked on over the years. So this is just literally a snapshot of the people who are currently working on PL. But we are, has already been said, a multidisciplinary team. And Dr. Rebecca Dillingham and Dr. Ingersoll are the co-founders of PL. And we really benefit from their visionary work to be able to make this platform available to organizations around the country. We have an in-house set of developers, and we have a robust implementation and adaptation team. And we're very grateful for all who have contributed to the work over the years. So PL originated out of a need that came that the UVA Ryan White Clinic identified well over a decade ago. For those of you who are not familiar, the Ryan White Clinic is based here in Charlottesville, Virginia. Our patients really come from 52 different counties in central Virginia. And these counties are largely non-urban settings. And when patients needed to be linked to or relinked to care, a team of social workers would go out into the field to each of these 52 counties, knocking on doors, and literally would bring people in to clinic to have them linked to care. This was a high-touch program, and it was short-term. It was about a 6-month program. And for those patients that, the social workers met with, 100% of them were linked back to care. However, once this high-touch program, their time in that program wrapped up, at 12 months, over half had fallen out of care. So there really had to be a better way that was less resource intensive and that was able to maintain the high touch elements of the program. So these are some challenges that our patients at the Ryan White Clinic face. They're certainly not unique to our clients or patients. But what Dr. Ingersoll and Dr. Dillingham wanted to do was really harness the power and reach of mobile technology in order to deliver interventions or tools that could address one or more of these challenges when and where people need it in order to live well with HIV. So that led to the development of PL, and PL is what we referred to PositiveLinks. And so PL is a care site deployed mobile platform that was developed to support people with HIV in staying engaged in care. It's a platform that's comprised of a patient-facing smartphone app and a secure web portal that's accessed by coordinators and care team. The patient-facing app contains various tools, and we'll walk through a number of them today, but they fall largely into 3 categories. There are tools that support care coordination, self-care monitoring, and access to social support. So on the app stores, PL can be found as Plus Living, and while you're able to find it, you can't actually, unless you're a patient that is tied to an organization and has an account created by that organization, are you able to get an account? But we'll talk more about that later in the presentation. What I'd like to do is describe how PL is configured, and I'm going to start with talking about the 3 different user groups. I've already started to throw some of these terms around. So what I'll do is describe that our members are the people with HIV who are enrolled in PL, and they access PL through a smartphone app on their device. The providers that's really an umbrella term that we use for anyone who's part of the care team. And these are just some example roles of people, of providers who utilize the PL platform. They are able to access PL through a mobile app that is tailored for providers, as well as an online portal. The third category we call administrators, and those are the people who are coordinating the program, and they have access to PL through the online portal and access a variety of different tools, including reports, account creation, content creation, etc. And so because the set of permissions that they have is so robust, they have access just through the online web portal. So how does PL work? So I've already said that we have a mobile app as well as a web portal. So a clinic or a healthcare organization that has decided to implement PL will enroll its clients or patients in the program, as well as create accounts for members of their care team as providers. And in there, they are able to access a variety of different tools. There are self-care tools that include daily check-ins, as well as a How Am I feature and lab results. Care coordination tools include appointment reminders and private messaging that between members and members of their care team, as well as a few other features which we'll talk about shortly. Also, people are able to access connections that through the app that they may not have been able to access in person due to stigma and isolation. And there is a private anonymous community board, as well as other features that allow for people to feel more connected to their care team and to others with shared lived experience. So the technology is the technology, but what we really say with PL is that it's the approach, the way in which the technology is utilized, that is the secret sauce. And it's really that we see that PL is warm technology. And what that means is that we use the technology in order to facilitate human contact, facilitate exchange of support, and to really utilize the tool not only to maintain communication, but also to foster it. So what I'm going to do is take you through some key features of the member app. We're not going to get through all of these today, but this is a screenshot of the member app, and I just want you to see that there are many different features. And if you'd like to learn more about any of these features, feel free to contact me. I have contact information at the end of this presentation. But we're going to go ahead and start with the daily check-ins. So each member gets 3 check-ins or questions a day that are available within the app. The first is a medication adherence question. So the phrasing is, did you take your medication today? And the person can answer yes or no. There's a notes field where they can add anything that they think would be relevant to reminding themselves of the context as to why they took it or why they didn't take it. And this question comes in at the time that the member has selected for themselves. So if I take my medication at 7:30 in the morning, I can set my check-in alarm to come in at that time. If I change it, I can manage that within the app, or for anybody else, they can set the time for whatever works for them. So the next check-in is the mood check-in, and you can see that there are 5 choices that a member can select, as well as the notes field. The third check-in is around stress level. And again, there are a number of choices here and a notes field. These 3 check-ins come in at the same time. So if my meds check-in comes in at 7:30 in the morning, then I'm also going to get the mood and stress check-ins at that time. And these self-monitoring tools allow the members the opportunity to reflect on how they're feeling. And when they respond to these questions, they can then go to the next feature, which is called How Am I? And have a bird's eye view on how they've been doing over time. Can help people recognize any patterns that might be supportive of their adhering to their meds, or circumstances that seem to make it more challenging for them to remember to take their meds. You can see that if you tap on any date, you'll get an expanded view, and if the person entered any notes, then they'll be able to see the notes there. Another key feature is the availability of lab results within the PL app. So CD4 and HIV viral load lab results are entered through the admin portal, and they are visible then, as you see here in these screenshots, within the member app. We use the opportunity to really clarify as to whether the labs are trending in the desired direction, as well as providing explanations about what CD4 counts mean and what viral load lab result or lab viral load amounts also mean. So a really important feature of the PL app is the community board. This is a private anonymous space where members are able to interact with each other and chat about a variety of different topics of what's of importance to them, whether it's about someone sharing feelings that they have around being newly diagnosed, or wanting feedback or wanting to share around disclosing to a new partner, or celebrating that they are now virally suppressed. It's also a space where an organization can post any news or any events that they want their client base to know about, so their members that are utilizing the app. So it is helpful because some members indicate that they do not want to receive mail. And so this allows for people to still access information, but in a secure and private way. So there is a messaging feature that exists within the PL platform. This actually was developed in its second iteration, and it allows for members, so the patients or clients, to message privately with members of their care team. So members cannot have private messaging between themselves. The only space where they can interact with each other is on the community board. The messaging looks a lot like texting, which you can see here in the second and third screenshots. And while it appears like texting, the messages don't display on somebody's screen like any other text would. All of this occurs within the app. On the provider side, if a patient has sent them a message, they'll get an alert to their email address that indicates that they've received a message and that they need to log into the portal in order to read and respond to the message. A key element to know about messaging is that it is not to be used for emergencies or urgent matters. Providers are allowed 48 hours, or when they're back in the office, next business day, should they be out on break or, whatever reason. And so while texting can sometimes feel like urgent communication, the members receive reminders after they've sent a message that they are to allow the provider that much time. It allows for people to avoid playing phone tag or trying to figure out the phone tree, and have found our case management team in particular have reported that they find it to be an efficient way to address matters with their clients. So the previous slide showed the member app view, and the other side to it is the web portal. And the portal is really the engine that drives the platform. Members use their phone app in order to connect to PL, and it's through the web portal that the admins and providers are able to access that information. So this is where messaging can occur. Admins are able to monitor the community board, as well as access different reports, and create content. So what I'd like to do now is share some of the outcomes from our first two studies in order to establish what our evidence base is for the PL platform. So in our first study, which we like to call version 1.0, we had enrolled 77 participants from the Ryan White Clinic at UVA, and 63% identified as male and 49% identified as Black non-Hispanic, and 72% were below the federal poverty line. In this population, we saw that there were increases in engagement and care, so retention, HRSA's retention and care metrics, and increases in viral load suppression among participants over 12 months of using PositiveLinks. We also did analyses to, so we also did analysis, oops, let me just back up here. We also did analyses to take a look at the community board, and what we saw was that I'm sorry, let me just move this chat window. What we saw was that stigma scores were improved with increased use of the community message board. We also saw that the board, the community board, is a space where social support was regularly exchanged. And this is that members were able to share with each other, empathize with each other, and just support each other in ways often, peer to peer. In our second study, we were able to track participants out to 24 months. And what we saw was that at baseline, 60% of the participants were virally suppressed. And after 12 months with PL, 88% were virally suppressed. And we saw this trend towards improvement in engagement and care here as well. And when we did further analysis, we saw that higher PL usage was associated with greater likelihood of achieving these benchmarks. And what higher PL usage means is that people have answered at least half of their check-ins a month. So that's really at the 48% response rate target. And that seemed to really be a predictor as to whether people were going to achieve viral suppression and retention and care metrics. So here, what I'd like to do is just have you have a sense of the timeline of PL and share some recognition and awards that the platform has received over time. So the initial work started in 2008, but the research really began, the research and development of the smartphone app began in 2013 and continued through 2017. In 2017, Virginia Department of Health began to support the implementation of PL as a usual care service to its Ryan White Part B subrecipients around the state. Over time, we received other grants to be able to further develop the platform and adapt it for different chronic conditions. I do want to highlight some recognition that PL received, including that in 2019, the CDC included PositiveLinks within its National Compendium of Evidence-Based Interventions and Best Practices. In 2019, NASTAD included PL in its evidence-informed approaches, and we had other awards as well. And HRSA in 2022 included PL in its best practices compilation. So the primary goal, like how is PL implemented? The primary goal is to enhance engagement and care. And PL has been successfully used by county health departments, as well as healthcare organizations in urban and non-urban settings, with cohorts of clients or members of 20 to 20,000 members, or sorry, 2,000 members. So, there are a number of different implementation models that exist. So I'd like to share what people are doing today. So we have seen models where it's the state health department that is providing support to its subrecipients to implement PL. And so that's what we've seen here in Virginia with our Department of Health. And we're very lucky for their ongoing support. We've also seen that PL has been successfully implemented by county health departments. And with the county health departments, we've seen that two different models. One where it's the county health department itself that's implementing implementing PL. So its own staff are managing the platform, conducting the enrollments, and implementing the program. We've also seen a model where the county health departments fund local organizations for them to implement PL for their own clients and patients. So there are a variety of different ways in which these implementations have been funded. With federal resources, we've seen Ryan White funds that support PL implementations, as well as ending the HIV epidemic funds. There have also been state and organization level resources that have drawn from 340B rebate funds that have supported the implementation of PL. And then we've seen where there has been private foundation support for the implementation of the platform. Specifically, the Elton John AIDS Foundation supported an implementation in Irkutsk, Siberia, and that was an adaptation called Most. So we adapted it for the Russian context. So what our team does is provide ongoing support for onboarding any partner so that they can successfully launch PL. We have a robust onboarding plan, and I know I have a lot listed here, but these are really just kind of the highlights of what the process is. I think the takeaway for this is that we establish communication with our partners early on so that we can really guide them through any kind of key decisions that they need to make around budget development, staffing support, thinking about how they will partner with local organizations or whether there'll be a standalone implementation. We expect and are prepared for various InfoSec and compliance reviews. And we work with the partner to develop recruitment plans and set reasonable targets and adjust where needed. We also provide live guided training for the administrators of the program. So the coordinators, the other folks who will be doing patient member enrollment or having any hand in the admin portal. And following that, we link people to our LMS, which has user-specific learning paths that reinforces what we covered in the training. And there's a certification program. So quick quizzes that ensure that people understand how to use the platform so that they can feel confident as they go forward with that. The LMS is available, for as long as somebody is a partner, and so they can always go back to that resource. And then we support the organization in curating content for their portal and support them through the launch and provide ongoing support at regular intervals. So just to say a little bit more about the guided training, what we do is we provide live guided training. We've been doing it over Zoom for since 2020, but certainly can and have provided it in person. What we really aim for is that for the trainings to be engaging and interactive, and we really tailor the trainings based on the attendees' roles in the clinic as well as with their use of PL. And it provides the opportunity for the onboarding site to practice using the platform and get feedback from our team before they go ahead and launch. Also, to say a little bit more about the certification program, we really emphasize the importance of completing the LMS and certification program because by being certified, it demonstrates that someone has the ability to use the platform as intended. And that is more than just how to create a quiz or how to edit a post. What we really spend time with is about best practices for utilizing the platform. And this is important because it builds awareness of, for PL, and it provides validation for the site care team that 100% of their admins and providers have become certified and they can feel confident in going forward with using the platform. It also lets us know as the implementation team at UVA, helps us identify any areas where additional support would be needed. And it also supports fidelity of the implementation at our different partner sites. So we have created various educational and training resources, and we create these resources in collaboration with partner sites. This image here is a one-pager that demonstrates the benefits to members. We have a number of other resources that we decided not to share in this particular PowerPoint, but if you're interested in seeing any of them, again, I'd be happy to provide them on an individual basis. But we have an explainer video that was developed for members and for providers that describes what PL is. It's a nice short 2-minute video. We have this benefits to members. We also have a benefits to providers handout. We have also created brochures, again, in partnership with the implementing organization for members and for providers. We have different recruitment materials, postcards, posters, and we have a features tour that's available that can be sent as a link via text to members so that they can get a tour of the features within the app, on their phone. So this is a slide just to show you that of the different places where PL sites have been in the US. As I mentioned a little bit ago, our biggest implementation was actually in Irkutsk, Siberia, with over 2,000 members utilizing the platform. But here we have sites in Virginia, as well as, pretty much up and down the East Coast and a few further west of the Mississippi. So PL has been adapted for not only for other chronic conditions, but has been adapted for Spanish speakers. The PL PositiveLinks adaptation is called Prospera Libre, and the P and the L are there to help anchor it in PositiveLinks. It's the same app. It's just that it's been fully adapted which is different than just a translation of the app. And it allows people to who prefer to utilize the app in Spanish to have that, and the implementing organization would also have the portal in the Prospera Libre portal, which would be in Spanish. We recently completed our adaptation for Haitian Creole speakers, and just as with Prospera Libre, it's the same PL app, the same features, but has been adapted for Haitian Creole speakers. And both of these are available to our partners, providing this as, a usual care service. The next few slides I'm going to share are of adaptations that we've done in collaboration with as part of research projects. So they're not available as part of the usual care portfolio, but PL has been adapted for youth, and our partners at University of Texas, San Antonio have been testing this adaptation with their patient population. We also have an adaptation that is called PREPT, and this was developed to support PrEP candidates in deciding whether they would be a good, whether PrEP would be a good tool for them, as well as supporting them in keeping up with their PrEP adherence. This PrEP app really led to the further development and of this adaptation called PCheck, which is what we studied with LSU for Black MSM who are taking PrEP, and also it allows them to keep track of different sexual behaviors, as well as the mood and stress, and keeping up with their PrEP adherence. Hope is an app that we developed with along with the University of Virginia's MAT clinic, and it was developed to support people with opioid use disorder in their while receiving MAT, the medication assisted therapy. And the Department of Anesthesiology, we worked with them to develop this adaptation called Positive Trends, which was developed and studied for people who would be receiving or undergoing orthopedic surgery, and having them manage expectations of pain level, as well as manage their treatment, their pain management following their procedure. And with that, if you'd like to learn more about PL, you can visit our website, which is plusliving.org. You can find more information on the platform, as well as access our manuscripts and other presentations we have there. I welcome any emails you'd like to send me at my address here, alw9t@virginia.edu, with any questions or comments that you might have. And with that, I will hand the reins over.
Thank you. I have a couple questions. With respect to other clinical conditions or chronic infections that would be managed through PositiveLinks, what are some of those?
So opioid use disorder, for example, is one. And so that would be with the Hope app. We are also So that would be one. And then there's HIV. I know that there has also been talk about over the years, people have expressed interest in blood pressure control as well. I know that we also have been working with a faculty member in the infectious disease department to develop a COVID symptom tracking app, as well as we are working with the School of Nursing. We have a partnership with them. They're testing and adaptation to support I'm sorry, cervical cancer screening from the point of testing through receiving the results and then completing the treatment if required.
And it looked like Dr. Ingersoll mentioned hepatitis C in the chat.
Mm-hmm. Mm-hmm.
Do you find, do you have any data with respect to, is there a length of time that someone might use the app for and then go their own way, or kind of things fade away, or I don't know, do you have any sense of how long someone would stay with the program?
Yeah, so I think on average, we've seen that people have stayed with the app about 5 years, which is pretty extraordinary. I think that like on one end of the spectrum, we have people who were study participants in that first study, so enrolled in 2013, and they have continued to use the app now over 10 years later. For others, it may have served them a purpose, served their purpose at a particular time, and they might back off. But one of the great things about PL is that there's no one right way to use the platform. What we see is that there are people who aren't interested in doing the check-ins. They're not interested in the community board, but they really like being able to access their labs and to message with their care team. And that's what they use the platform for. But if they find that maybe they find themselves in a situation where they do want to reach out and get some peer support, then they might then check back in with the community board. So we do see that the way in which people use the app over time changes.
Yeah, it looks like Dr. Ingersoll again mentions some data with respect to just how brief typical usage of apps 1 time to 1 week are compared to how long people are engaged with PositiveLinks. How about one other question? How about what is there any support for people who might have kind of, I guess, instability with respect to access to a phone, or they might have a phone for a year and then because of financial reasons or something else lose access to that?
Yeah, absolutely. So a key component to how PL is implemented and what we recommend is that for people who don't have a smartphone, that the organization provide a smartphone. And we're not talking about the newest iPhone, but there are prepaid devices that the price point can be $50 to $75, depending on what specific features you're looking for. But what we say is that if somebody needs a smartphone, we're so lucky that Virginia Department of Health has provided support for those phones so that people can have access to the phones. But then what people also need is support in maintaining their phone service. So when someone enrolls in PL as part of the agreement, they understand that if they answer about half, again, that magic number, 48% of their check-ins a month, then they will earn what we call a phone credit, a subsidy towards their phone bill. We're not paying their phone bill, but we're providing them with a credit. So it could be a prepaid phone code that then they can apply the $40 or $50, depending on what the organization has been funded to provide directly to their account. For months that they don't earn their credit, we can't provide them with that amount. but they're not kicked out of the program. The app isn't turned off. Clearly, those who are most vulnerable with not being able to access the app are those who cannot bridge that gap between having earned the credit. But it's really what we have seen, that to be able to provide that phone credit, it supports people with maintaining a stable phone number, which we know reduces the likelihood of their falling out of care.
Thank you.
So there is a question here that came in as a direct message. How do the messages between patients and providers get added to Epic so the rest of the care team is aware of recommendations made in the chat? So what we recommend is that if there are recommendations or notes that should be in Epic, that the provider copy them over into the notes. We don't have an integration where the messaging from PL could be directly copied over into an Epic note.
Thank you so much. I think it's really wonderful. The technology is great. I think what really kind of stood out to me is the term that you use, warm technology. The technology is one piece of this, but it's really that integrated team that you have around the app that seems to really be engaging the community, communicating, with people within the community, with their clinicians and providers. And I think that's a really important piece of this. The technology exists. Not me personally, but lots of us can build the technology. But how do we really get that into somebody's daily life in a useful way to build connection? And I think that term of warm technology, and then how you describe how that integrates with not just the participant, but also with the collaborating group that you're working with as well, I think is just really something I wanted to highlight. And Dr. Ingersoll says warm technology drives connections to the care team. And I think that's just a beautiful way to say that. So thank you for highlighting that. I think that's something that we can take forward in all of our technology. It's not just the tool, but it's how do we use the tool with the people that we work with. So I think that's great. Speaking of technology, I do have a technology question though. You mentioned smartphone and kind of how the platform is there. Is there an opportunity to use the app on a larger screen device for somebody who might have, visual limitations or anything like that?
Yeah, so it can be, so long as the person is able to, connect to one of the app stores, then it can be downloaded and installed onto a tablet. It doesn't have to be a phone or a device that has phone service, but it needs to be able to connect to the internet.
Cellular. Great. And yeah, I just think it's really exciting, especially how you talked about the community engagement and seeing stigma scores decrease with the increase of the engagement. In kind of thinking back or wondering your reflections over the past decade or so that you guys have been doing this, and kind of seeing the upsurgence of chats in general and online communities and resources. Do you feel that people are more open on your chat platform or more reticent, or is that anything you've noticed kind of over time, just in view of the kind of underlying background of use of social medias and things?
Yeah, that's a great question. What we've seen is that people are really willing to share a lot on the community board. And people know that when they enroll in PL, whether it's at UVA or at whatever other organization, when they're on the board, they're interacting only with other clients or patients of that organization. So they know that they have that in common. And I think, so when we talk about our PL users as members, that really comes out of they themselves identifying as a family. When people first joined, I'm thinking back to our first study, we would, people would join and they'd get on the board and be like, hey, I'm whoever, their username, not their real name. I'm new here. People would be like, hey, welcome to the PL family. And so we really went with that, in that, when people join PL, they're now a member of that community. And they understand that when they're seeing posts around events or announcements that are made by the PL staff at the organization, they know that it's of importance to them, that it's curated information, and it's very personal. So, yeah, people will share around, the loss of pets, having found love or whatever. But I think that people have been very open, and it's in those kind of vulnerable exchanges where people just come together in ways that they may not reach out to each other in person.
Fantastic. That's really just exciting to hear about and to think about all the possible implications for that type of technology and chronic conditions, chronic infections, but in so many other ways that we take care of people. So thank you for sharing that. And perhaps we have others, present today who are thinking about their own practice and how, that could be a tool in their practice. And it'd be exciting to see how you guys continue to grow over the next coming decades as well. So thanks so much.
Thank you.
With that, any other questions from the group? Feel free to unmute or to put into the chat.
I was wondering if there was, say, a patient who maybe wasn't able to use the application for some reason and had a very involved caregiver. Is there any kind of forum for caregivers to get involved or to be part of PositiveLinks?
So currently, no, there isn't. What we do is, so the PL liaison or coordinator really is the bridge between the patient and making sure that they can use the platform to the best of their ability. So, in addition to the various tutorials that we have, I'll just give a shout out to Kayla Shiflett, who is on this call right now as our PL liaison. And, what they'll do is really work closely with the members in order to make sure that, they know how to log in. And if they're having trouble sort of figuring out like what the check-ins are, we have made sure to include emojis and other symbols that people can be like, okay, I recognize that that's my meds check-in. And if I tap on this, green means I answered yes and red means no. And just other ways to support people. But, we do indicate that during enrollment that it's important that they protect their password and that they don't share it. But if a caregiver, wants to be of support, while a liaison is providing that training to sort of remind them how to make a post or where they can find their appointment reminders, then, we want to honor that.
Fantastic. Well, great. Well, thank you so much for joining us today. It was a great way to hear about the program that you guys have been involved in and really to think about how technology and infection management really can come together in a very exciting tool. So thank you for that. And I also wanted to say thank you to everybody for joining today. It's great to see some new faces or names, see some new names as well as names that we've been seeing over the past year as we've been doing these ECHO sessions. And so I just want to thank you all for your support of these sessions and in this community. This is our last session as part of this VDH-funded grant program. We are looking to grow in new ways, and so stay tuned for that. I'm sure you'll see much more from Anthony to keep you updated on where we're going and what we'll be doing. And now I'll turn it back to you, Anthony, to move forward.
Absolutely. Thank you. Yes, I would echo what Dr. Archibald Pannoni said. Thank you for attending over the past year. This has been a great experience for me personally, and we really appreciate your engagement. And we are going to move in some directions different than with VDH. And I will keep everyone updated with respect to that. And I will also send an email out within the next week or so with a link to the recording and the past recordings and kind of our next steps of where we're headed from here. So much appreciated. Ava Lena, thank you very much. It was a great session today and much appreciated. So
Well, thank you.
thank you, everyone.
Thank you. Take care.
Thank you very much.
All right. Bye.